Namaste and welcome to the Federal. As a part of our continuation coverage on the COVID-19 coronavirus situation, today we are joined by a public health expert and public health policy expert, Dr. Sundararaman, who will be joining us from Puducherry. Dr. Sundararaman has been the executive director of national health at Delhi and has been a part of various movements, especially about taking science to public at large with his People for Public Health movement. He's gone about trying to educate people and trying to reach out to the groundswell or the root about the need for such science communication and public health communication. Thank you, Dr. Sundararaman, for joining us. Straight away to the question, where are we right now in India as far as this COVID-19 is concerned? Especially from the government policy point of view, where are we? I do have a lot of questions, but I don't want to straight away start. Just an introductory comment on your part, and I will later join in with the questions.
Yeah. Thank you for having me. I have worked for some time as the executive director of the National Health Systems Resource Center, and I basically work in the health systems and public health area, and also with People's Health Movement, of which I am currently the global coordinator. Where are we? I mean, the honest answer is we really don't know. We know that we have some 125 to 30 cases, and we have 2 to 3 deaths. But we are really testing very, very minimally. We are restricted our testing to contacts or people who have returned from abroad and their contacts who are also symptomatic. So they
Sorry,
could be
asymptomatic or
symptomatic,
symptomatic? I missed that.
symptomatic, who are
Symptomatic.
symptomatic. That is, who
Okay.
have signs of ill, who are ill and have returned from abroad. If they have returned from abroad and they are not ill, they are not getting tested, because you do know that there can be people who are carrying without a thing, or at least have very mild symptoms and be carrying the disease and infecting others, that we will miss. And we will also miss the thing. So that is, but actually, but in the experience of most nations is that community transmission does get established. And there is no reason to think it will act differently in India. But we are absolutely not testing for community transmission. So we don't know whether there is a lot of coronavirus infections around, because clinically they will be no different from seasonal flus and even a severe bout of cold. And most of the exacerbations that they have, the severe cases, will be attributed to other severities, and people will not look for, unless they look for coronavirus, we won't find it. So we really don't know where we are, and we are hoping for the best, but I am afraid we need to prepare for the worst.
Uh, where are we in terms of testing? Are we? Is there? I mean, is there any particular reason why we have not done that many number of tests? Uh, Even we had our case where in Tamil Nadu, the health minister who proudly said that out of 78 people 79 people who were tested, 78 turned negative. And what caused panic was how only 79 people in Tamil Nadu been tested. So
So
what is this
government,
which is stopping extensive testing?
so government testing is so limited. In Tamil Nadu, only two centers are accredited. One is the Gindi Center, Gindi King's Institute, and the other is in Theni. Imagine, I mean, how these two centers will even be able to reach out to the large numbers of people with flu-like symptoms. And South Korea's population is about 60% of Tamil Nadu's. Okay, we have tested 78 in 7.5 to 8 crores. They have tested 250,000 cases. Okay, so that level of testing in South Korea showed that completely unpredictable way, unexpected areas showed a huge disease. So there will be some districts which have no disease and some districts which will be full of it. And there is no exact way in which you had predicted it, because they had testing at that level of spread. They could identify the clusters, focus their measures there and cut it down. Here, we are just testing in two relative corners of the state, and we don't really, even if there are samples being sent, they are far too little, far too minimal, and in fact, therefore, we really don't know where we are. There are states like Jharkhand where it is even worse, and at some point, we really don't know. I think this is somewhere, and I would be even more worried because government has begun to claim success in its control measures without even knowing whether they are working. Hopefully they'll work. Hopefully there are natural factors that help us. But public health isn't built on hope, it is built on evidence, it is built on preparing for the worst. We have to anticipate problems, we just can't be wishing ourselves luck.
Yeah, I was exactly coming to that. Is this the sense of complicity which is still going around with statements like, the heat will take care of the virus, we have a larger, better immunity system in India, and do you think that
Going about that, I really think that we are heat, yes, that may have, but we can't really count on it. And what happens after the heat goes away? So at some point, I don't think this is an adequate approach to it. But the reason for us to be so complacent actually also arises from the fact that there is a emphasis, so such an exclusive emphasis on social distancing, like a cure all, that we pass the responsibility from what governments must do to what people must do. There are things that people must do, and this is very critical. I don't want to underplay the importance of that. But that having been said, you can't in many ways implement social. A lot of it is gratuitous advice. A lot of it is advice that would be suitable for an upper middle class family, but it's not implementable within a crowded slum, within a place where there is one room where four people are staying, where the people who have to earn every day, they have to go to work even when they are sick. So many of these measures are not really implementable or implemented. In fact, if you go around into rural Tamil Nadu, you see life as usual. They can't just be staying at home for a disease that has not yet arrived. Okay, at one point you say we have no cases, and then another point you want everybody to be in this. What happens when you have cases? By then you have already exhausted things. So somewhere governments feel that it is the social ban of gatherings that is the key, not the rest of the work. So testing is de-emphasized, intensive care and ventilatory care preparation is de-emphasized, and what you have is a singular focus on what people must do rather than what needs to be done. And some of these measures, we are very uncertain. This closing of schools and colleges, will it help? Perhaps it will, but young people are relatively uh, immune from getting severe forms of the disease. This we know. Then what is the logic in closing schools? The logic supposed to be that they may not have live disease, but they are at great risk for spreading the infection.
a simple question? So, to the policymakers, what would somebody like an organization like People for Health Movement have a word of caution or advice in the present context?
I think that we should continue to be cautious, and I think we should prepare district health systems and proceed as if we would have an epidemic. We would be fortunate if we don't have, but if we prepare the system to cope with it, there are lots of benefits that you would have anyway. Increasing the ability to manage emergencies in the public health system is necessary, irrespective of the epidemic. In the north, hospitalization rates are already very low. At some point, access to hospitalization services is very poor. So the public health systems needs strengthening anyway, and this is as good a time to do it. It should have been already done. We are poorly prepared for it. But now that it has come upon us, and it has become a political priority. The way to go about it is not to shift the entire burden to what people need to do to protect themselves, which of course they need to do, but to really focus on what the state needs to do to see if the epidemic comes through. This is not the first time we have had an epidemic, and this is not going to be the last.